Thank you. So my name's Heather Bauer. We're all midwives, actually. We should say that to start with. I'm head of education at the Royal College of Midwives, previously a midwifery lecturer. So I'm just going to give you a quick overview of why we started this work. And what we've created is a decolonising toolkit for midwifery education. So picking up very nicely on your case study, one of the reasons why we wanted to do this work is because black women are 4 times more likely to die in childbirth. Asian women are nearly twice as likely to die in childbirth in the UK, in the NHS, which is truly shocking. And we're not going to go into the reasons for that, but we believe as midwifery educators that everything starts with education. And that's what we, so that was our starting point. We also had a student webinar. We've got a student midwife forum at the Royal College of Midwives, and they chose to do a webinar on decolonising the education, which kind of challenged us at the time. And then they said to us, we want you to take the work further. So they've worked with us to do this too. And also there's really nothing like this in midwifery. So nursing, there is dialogue around decolonising nursing, but not really anything specific to midwifery. So this is the first work of its kind that we know of. So we set up a stakeholder group, which was all-encompassing. We had all those different people in it. RCOG stands for the Royal College of Obstetricians and Gynecologists, so it was really important to include them. RHO is the Race Health Observatory. So we really have had a wide group of academics, students, midwives, and the stakeholder groups, so that was really good, both face-to-face and online work, and we did a very concentrated period of time over 9 months to develop this toolkit, and we launched it in March. So that's me. I should hand on. Just the purpose of the toolkit. So the aim is to empower midwifery educators to challenge the implicit and explicit legacies of colonial perspectives in all aspects of midwifery education. That was kind of an agreed starting point with stakeholder group. So I'm going to move on from that actually, because I think we are out of time. So Zaheera is going to talk about recruitment.
Yeah, there is a laminated sheet that's circulating with the QR codes if you want to look at the toolkit in your own time. So hello everyone, my name is Zaheera Essat and I'm a senior midwifery lecturer here at Montfort University. As an admissions tutor, I've been working really closely with our midwifery team, particularly the lead midwife for education, to look at our midwifery programme in the context of the toolkit. And of course, as admissions tutors, we're always looking for strategies to ensure that there are those equitable outcomes within our, for our candidates, and equitable opportunities when they do apply. So what I'll do today is just touch on very briefly some of the strategies that we've been looking at. So to begin, University Open Days are an early opportunity to demonstrate that equality and diversity, and that initial perceptions that the candidates and their families have are really important. So what we've been doing is working really hard to look at our students, so student midwives and student midwives of diverse backgrounds. Are they becoming ambassadors, brand ambassadors, and encouraging them to be brand ambassadors who will then engage with candidates during open days and other events, so events within the university and outside as well, but really importantly, targeted widening participation events within schools and or colleges. So we do recognise that there is an increase in global majority students entering higher education. However, we don't see this representation in midwifery, and that's not just locally. This is a national picture that we're seeing. So the previous admissions tutor has worked really hard to work on this area, and there are a number of strategies that we've been looking at. So one is, do we score personal statements? And we don't, because we know how it impacts particularly Black, Asian and other minoritised candidates. And that's because they don't have equitable opportunities in terms of preparing for applying to university, including writing personal statements, and that's to do with resourcing and other challenges that they have. So we want to try and reduce some of those disadvantages so that when they are competing with other applicants, we try and level the playing field, but we know that's never really truly going to happen, but we still need to look at ways. And so as a result of adopting these sorts of strategies, what we've now noticed is that our student group is changing. We are seeing that diversity now, and that's brilliant. We are seeing that representation within our cohorts, and I certainly am going to be monitoring that really closely. And that's because the evidence tells us that we need a diverse midwifery workforce to address the disparity that Heather mentioned. So we need to ensure that we are seeing diversity within our cohorts as well. Because at the end of the day, the students are going out into practice and caring for women, birthing people and their families. So just looking at our service user involvement, they are from the local community and are involved in the midwifery programme, including recruitment. So they actually interview our candidates as well. And something that we've been recently looking at is our interview questions. So we adopt a values-based approach to recruitment, and I'm really glad to say we have a scenario which involves racial bias. And what that has allowed is our candidates to also share their experiences too, which has been fantastic. We also recognise the importance of EDI and cultural safety training. So anybody involved in selection and recruitment has to complete the mandatory training, including our clinicians that come from practice to be part of the interviews. And that training is essential, okay? Training that creates awareness around subjects like conscious and unconscious racial bias, especially against applicants with protected characteristics. And then that data collection that we need to gather as well, the importance of how data collection, not just for recruitment, but also for other aspects like attainment, which I'm sure my colleagues are going to touch on. Because what it does is it creates that transparency, it creates dialogue and opens conversations, but really importantly, prompts targeted action as well. So very quickly, just a brief overview of some of the areas that we are currently, we have focused on and are currently still focusing on, which I'd like, I wanted to share with you in terms of recruitment. But I'm going to hand over now to Maxine.
That's talking curriculum. Okay. Thank you. Hello, my name's Maxine Chapman, and I now work at the University of Leicester, but formerly worked for my colleagues Bernie and Zaheera, and was able to get involved in the work with the RCM in developing this toolkit. So I'm going to talk about the actual curriculum. So thinking about, there's so much overlap with what we've heard already in terms of being flexible, a flexible learning approach, and actually involving our students in co-creation of the teaching materials. So some of the key points that, we know we've got a long way to go in addressing the ethically diverse teaching staff, very much minority in my university on the programme in which I teach, and that presents some challenges, but also it's quite a privileged place to be in terms of students feeling some sense of belonging and being involved in some of the activities that the students want to drive forward, and being that kind of reference point to actually support the students in what they want to achieve in terms of increasing representation within the curriculum. Ongoing cultural safety training, and again this is something really important. I'm going to give you some examples that we're doing at the University of Leicester. And then throughout our curriculums, what we should be focusing on is cultural safety, so actually having lectures focused on allyship, microaggressions and systemic racism. So these are some of the key principles. There's more around that in the toolkit. If you scan the QR code, it'll take you directly to it. So what have we been doing at Leicester? So I know one of my colleagues has done a work stream today on the racial inclusion workshops. So these are spaces where staff and student come together and look at, well, what is it we want to achieve through our curriculum? What activities can we actually embed within our teaching spaces to ensure that our curriculum is inclusive? And in the school that I'm part of, each programme within the school, so we've got quite diverse healthcare structure. We have midwifery, of course, nursing, physiotherapy, radiography, and we have a huge medical school at Leicester as well. And what we're aiming to do is look at what particular actions can we implement within our curriculum. And we sign up together in terms of the staff will work with you, what is it you want to see in the curriculum. So what does that look like? So, for example, targeted assessment support for our students. We know about the race awarding gap. So what is it we can implement to actually reduce that awarding gap. So that might look like targeted assessment support for our global majority students. The challenge is there around who actually is the person that the students will go to, and kind of brings me back to representation within teaching staff. So we know we've got a long way to go, but racial inclusion workshops, active bystander workshops. So I know you shared the scenario before, and the active bystander workshops are a space where staff and students, as part of the induction to the university, certainly across the School of Healthcare, we have scenarios that are real scenarios from practice that previous students have shared with us, their experiences, and we look at those scenarios and we think about how would you address that? If you were a bystander witnessing that behaviour, what would you do? How could you address it? Would you actively intervene at that point in time? Would you go away and think about actually what reporting systems do I have that I can use to highlight that this is a problem either in the teaching space or within clinical practice? Because as many of you may know or don't know, that 50% of our training of our midwifery students is in clinical practice. We'll come to practice in a moment. But looking at what examples, so development of a charter to prevent and address racism within the teaching spaces, and actually having safe reporting systems. So do the students know what that looks like? So some of you might be familiar with the BMA Charter, the British Medical Association Charter. That is something we're adapting within our School of Healthcare, so working with our students to look at, we're developing this charter together. I mean, this is wonderful stuff, but we've got to see how we're going to evaluate that this has been effective. So it's early days, but these are the kind of activities that we've been involved in at Leicester. And as I say on the QR code, you'll see other examples of what other universities are doing nationally, particularly the University of Salford, which you'll find on the website. So that's curriculum. There are 4 sections to this.
So hello, I'm Bernadette Gregory. I'm a senior lecturer in midwifery here at Montfort University and a fair outcome champion of the Decolonising DMU project. So assessments, as it says, ensure assessments do not perpetuate racial stereotyping and microaggressions, but promote cultural awareness and safety using the lived experiences of women, birthing people and families. Now, when we're planning assessments, we need to be thinking a pre-validation on the actual prior to the day, on the actual day as it's happening, but also to reflect afterwards, was it fair, was it equitable, did everybody achieve? We've been talking a lot about awarding gaps, which is where this Decolonising DMU project came from, morphed from a Freedom to Achieve project looking at attainment gaps. So do we look afterwards at success rates by student name and ethnicity? Do we look at things like racial literacy? Do we look at, when we say things like formative assessment and summative assessment, they've just come from a college where they've talked about mocks, something simple like that. Things like knowing your students is really important. So things like to be inclusive and to be anti-racist, we need to think of with every person involved, admin, timetabling, librarians, the external examiners, everyone. Why on earth would we launch a module on Chinese New Year or Eid? Why would we think to put an assessment on during Ramadan and then disadvantage students straight away by being late in the afternoon simply by their surname? These are so simple things that we just aren't getting right. But again, learning from students. Anyone disadvantaged? If you've got to use a smartphone, if you've got to have a laptop, if you've got to have a private, quiet space at home to record an assessment, have we thought about every student and being able to be really inclusive? And we say assessment plays such a key role. I mean, this is the first 2-1. This is employment, not employment. So it really is quite important. And just that feeling of feeling good that you've passed, but that you also got a good mark and it was recognised. The student in the room is nodding. Yeah. So are your assessment guidelines clear, transparent? Are you using authentic assessments? We've talked a lot about case studies. On the Decolonising DMU website, you'll find a large amount of case studies and best practice of what people have used already. Co-creation again with service users who are actually out there experiencing the NHS. Current staff and alumni who went through that same process and said whether it was a good assessment or not. So again, though, very importantly, about not advantaging students, but also not perpetuating stereotypes. So talking about deviations from norm, talking about a disadvantaged or a vulnerable individual. Show that representation in your curriculum, but also in your assessment, using authentic names, authentic scenarios. Show representation also of the service users, but also about the staff, because, you know, our NHS staff is incredibly diverse as well. You'll see that on the poster, a lot of this morphed from our interest in being colour aware and production of 2 papers, authors in the room, in the practice in midwife, where so many staff said, well, we haven't been made to think about being colour aware. And so that now I know has generated a whole load of things like looking at neonatal jaundice and progress in labour for women. But again, is that in your assessment strategy? Encouraging students to value and credit the knowledge of authors across the globe, you know, in their assessments. So what are your reference lists looking like? What are your reading lists looking like? And encouraging that wider background reading. I have started with a book club that's now a DVD, a streaming, etc. club, but to make some students who feel that first books, you know, the big tomes are very inaccessible, start with some really good novels. And there are some fantastic novels by black authors and women of colour who really make you think. And it's good because then the students get different perspectives. Who's on your assessment panel, what EDI training they have, same points about recruitment, and then listening to the students who struggled, if they've not done well, why did they not do well? Could we do better? We introduced a fit to submit checklist, and that was revolutionary because students said, there's a checklist on the day, press send, but I have checked that I've done everything that I was supposed to do, and that made a big difference in our marks. Okay, over to practice. Maxine.
Okay, unfortunately, one of our amazing students, Selena Palmer, is a third-year student at the University of Leicester. She can't be with us today, but when we launched the toolkit, she presented her experience of practice, which was powerful, and I don't think there was it was so silent in the room when she presented. She's actually up for an award today, which is why she couldn't be here. So she's down in London, hopefully getting that award. We'll wait to hear. But what she really wanted to share was about her experiences, thinking about how we support our students in practice where they are 50% of the time. Because what we know from an NHS survey that was taken in 2022, black and ethnic minority staff are twice as likely to experience discrimination from the public and nearly twice as likely from NHS staff compared to their white colleagues. So we know, and I certainly feel it when we send our students out there, have we equipped them ready for that environment which can be quite hostile, and yet, you know, we're going out there to serve our communities. But our students are faced with this, and one of the key things was about them feeling safe and having a safe person, someone to go to in practice. So we have layers of support within midwifery practice in terms of professional midwifery advocates, so a named identified person. But it's more than that. It's got to be, you know, as university lecturers, we go out into clinical practice, we support our students, but we're not with them the whole time. Thinking about the practice supervisors, so the members of the registrants in clinical practice who they work alongside. Thinking about who are the safe people, and a lot more work needs to be done around this because we know fundamentally the NHS is fundamentally a racist system. When we look at the statistics and when we know about the outcomes for women, for black women, we know there's a long way for us to go. But how do we protect our students, and thinking about the people they interact with, how do they raise concerns? So there's lots of policies and contact numbers and so on that students can maybe get involved with, make referrals through, also get the support from the university. But there's still a long way to go in students feeling safe to report, and the repercussions of their reporting. You know, they are vulnerable when they go out into practice. They are student learners, and they've got to, what was the term that Selena used? Code switch. So adapt to the culture in which they're going into, and that's quite powerful, that they can't bring their authentic selves to those areas for fear of repercussions of the colour of their skin, their culture, the food they're eating, their prayer practices, and the discrimination that the students have shared with us. What happens when they report? We've still got a long way to go in terms of students feeling safe to report and knowing what the outcome is of that report. So we are working towards reporting systems, working very closely with our practice partners, but fundamentally we can do what we can do in education, which is the starting point for our students, but we need to work very closely with our practice partners, with the institutions, the clinical areas where our students are going to. So there's a lot of work to be done there. So it's about developing those partnerships with further developing them with our practice placement areas. That our students feel safe to be in those areas and they are welcomed into those areas, that they see themselves as belonging in those areas. So that can be simple things like imagery and signposting to areas of support. And if you go into these spaces, you don't necessarily see that. So work to be done in that area, but it's very important that we work very closely with our practice partners in trying to achieve this reporting system so our students feel safe out there, and hopefully get to a point where these case studies, there are examples of where action has been taken and it's made a difference to that student's experience. And also recognising that, we're quite fortunate, I feel, in Leicester, diversity, and that's not always the experience of other universities. So looking at how can we look at working together to provide placements for our students in different parts of the country. So working in partnership with other higher education institutes so our students get that experience. Because ultimately, although we train our student midwives in Leicester and we want to keep them in Leicester, we train them to work nationally. And not all students get that experience of caring for diverse populations. So thank you, that was practice.
I can see Blessing looking at us, so I'm going to wind up in 20 seconds. So we got the document online, so please go onto the RCM website and you'll find it if you haven't got the QR code. We have now sent one printed copy to every university in the UK, so that includes our devolved countries. And for the future, we've got 3 actions: disseminate, evaluate, and generate. So disseminate is what we're doing today, and we've done a lot of it, haven't we? We're talking to the Council of Deans, Health Education tomorrow. Evaluate, so that's our next piece of work as a steering group, that we're going to see really how this is being used in the universities around the UK, and there are lots of universities like here that have already started. And generate, we really want to generate this message and spread it and get it out to other healthcare professionals as well. That's it.
Thank you.